Hello girls, I hope you're staying safe at home. Now, today we are going to move on to a new chapter which is known as health organizations. Now, what are health organizations? These are organizations which are founded at different levels in a country. Now, why are such health organizations founded? Because health is one of the main concerns of all the government of the world. They first look after the health of the people. Now, right now in this COVID situation, you know that the schools are closed, there are lockdowns imposed, and all these are being done by the government. We are listening to what they are telling us because the government wants to save the people from such situations. So they take steps individually at the national level as well as collectively together at the global level. Means different countries, they come together. Why? So that they can safeguard the health interests of their people. Okay, so here in your syllabus there are two main health organizations you have to learn about. That is the international bodies, Red Cross and World Health Organizations. Now, Red Cross, I think all of you have seen this emblem if you go to the hospitals or in ambulances, which is used only by the Red Cross. Okay, so the Red Cross is a national as well as an international agency. That means in India, at the national level, you have Red Cross Society, India, but again there is international agency Red Cross as well. Okay, so what is the main function? That is what you have to learn, the main functions of the Red Cross Society. Okay, so what is the main function? It performs activities which prevents or removes human sufferings, which includes not only during times of peace but even during times of war. It was founded in 1864. You don't have to mug that up. And of course, you know, I already showed you the emblem of the Red Cross Society is a red colored cross painted on a white background. Okay. Now, people belonging to the Red Cross. Now, if you are a member of a Red Cross Society, you can go to battlefields to take care of the wounded soldiers, whether friends or enemies. Now, supposing there is a war between India and China. Now, Indian Red Cross members can go over to the Chinese side and help the Chinese wounded soldiers, and even the Chinese members of the Red Cross Society can come over towards the Indian side and look after the wounded soldiers. So there is no such thing as friends or enemies in the Red Cross Society. They look after all the humans as one. Okay, so this is the main thing you must learn, the major activities of the Red Cross Society. First is to extend relief and help to the victims of any calamity, flood, fire, famine, earthquakes. Okay, a few years back there was a huge earthquake that took place in Nepal and so many people died, and that time I don't know how big you were, but you know, the Red Cross Society from all over the world, they came over and helped the people in Nepal. And next is to procure and supply blood for the needy victims of war or other calamities. I'm sure you must have heard about blood donation camps that is set up by the Red Cross Society, and anyone can go and donate their blood, and the blood is kept in a blood bank and then it is used whenever required. And next is to extend all possible first aid treatments in any accident. If there is a major accident, the Red Cross Society members, they go there and give first aid. First aid means the treatment given before a person is taken to the hospital. And next is to educate people in accident prevention. They also teach people how to prevent accidents, because you know, prevention is better than cure. And they also arrange ambulance service in all emergencies. The ambulances which has a Red Cross, remember, children belongs to the Red Cross Society. They also look after maternal and child welfare centers, especially in the hospitals. Okay, they are very concerned about a pregnant mother and little children. So if you happen to go to the hospital, if you look at the place where you know the pregnant mother and children are looked, you will see there is a Red Cross. That means that that department belongs to the Red Cross Society. And the Indian Red Cross Society has also been engaged in training midwives. Now, who are midwives? Midwives are, women who are trained to, help a pregnant mother give birth, especially in remote areas where hospitals are very far away and a pregnant mother cannot go and get good care. So the mother will give birth at home. So in such cases, these midwives are trained in such a way that they can help the pregnant mother give birth easily at home, and they will teach the mother all the things that follow after a childbirth. Now, next thing you must remember, children, is Red Cross Day. That is on May 8th. Okay, you may get this in your one-word answers. Now, next we move on to WHO, or World Health Organization. Okay, now have you done that in your history? I think you have done that. Or if not, you will be doing it. It was founded in 1948 and it is a specialized agency of the United Nations Organization, or UNO. Now, why was the WHO formed? Nowadays, you must have heard about WHO. It is in the news because of this COVID situation. Now, member countries of the UNO, they focused on need for creating an international body to look after the health problems of the people of the world. So, this was felt especially in the field of research on the causes and cure of diseases. And this combined efforts coming from all different countries that belong to the UNO gave better and faster results. Of course, they are still trying for a vaccine for COVID, but till now no results have come, and it is the WHO who is looking after all this. So the poor and developing countries especially were to benefit more quickly. Now, WHO has 6 regional offices in the world. One is in Delhi, okay, and each regional office works for its member countries. Now, its headquarters is located in Geneva, Switzerland. Children, this is also important. And member states of the WHO are bound by international sanitary regulations to send all relevant information. Relevant means the correct information about internationally notifiable diseases. That is, all the countries must be aware of this disease. And 2 such notifiable diseases are malaria and smallpox. Okay, smallpox has been totally eradicated nowadays, but still if there occurs such type of disease again, they must notify the WHO. And of course, nowadays you know what is there? Corona. Now, what are the main activities? This is most important. Activities of the WHO is to collect and supply information about occurrence of diseases of epidemic nature, pandemic nature, such as cholera, plague, typhoid, yellow fever, smallpox, and you can also add COVID-19 to it. Okay, so they have collected and taken all the information, and now they are trying to bring up a vaccine. All the different countries which belongs to the UNO come together, and they have formed WHO to look after the health of the people. So they are trying their best to find a cure. Actually, the cure for viral diseases is there is no medicines, no antibiotics. So the only way is a vaccine, and of course, you must have seen it in the news, that is underway. Next is to promote and support projects for research on diseases such as cancer. Okay, so for any diseases there are projects, okay, and they are studying about that. Now, of course, for cancer also till now there is no cure, so that also they are trying to find an answer. And next is to supply information on latest developments about the use of vaccines and about health hazards of nuclear radiation. That is why WHO is continuously giving us updates about the vaccine for COVID-19. If you are watching the news, you will know that. And next is to suggest quarantine measures. Now you have come across this word. You know what quarantine means. You go into isolation so that you do not spread the disease to others. Okay. And to lay pharmaceutical standards for important drugs to ensure purity and size of the dose. Now if you take any medicine, I think you know it is either 500 mg or 250 mg or 25 mg or 5 mg. That means the size of the dose, a standard, a pharmaceutical standard has been laid, and this is done by the World Health Organization, and to organize campaigns for the control of epidemic, widespread and endemic diseases. Okay, so this is a very short chapter, children. We've come to the end. Okay, and for your assignment, write down the main activities of the Red Cross Society and World Health Organization. Okay, so till then, children, stay safe. God bless you.